Hi, I'm Dr. Fox, and let's talk about the esophagus. In this video, we'll discuss the parts of the esophagus, how they vary, their pathways and contiguous regions, the innervation and blood supply of the esophagus. So let's start with an overview. The esophagus is a meaty tube that connects the pharynx to the stomach. It's about 25 centimeters in length. I live in the United States. That's about the length of a loaf of bread. If you're French and your loaf of bread is a baguette, that doesn't mean you have a gigantic esophagus. You still have one that's probably about 25 centimeters. It's also about 1.5 to 2 centimeters in diameter, but it is very distensible, so it stretches as boluses of food move along them. We can break down the esophagus a number of ways. Probably the most superficial of ways is an upper third and a lower 2/3. That upper third is referred to as the cervical part because it is traversing the neck. It is striated muscle, so that's skeletal muscle tissue. It's under control of the recurrent laryngeal nerves, which are branches of the vagus nerve, cranial nerve 10. It's supplied by blood largely through the inferior thyroid arteries. And it's more under reflex control. That's part of the deglutition reflex. So when you take a bite of food and you decide that you're going to swallow, that is what activates that cervical part of your esophagus. The lower 2/3 of the esophagus consists of most of the esophagus, which is the thoracic part, as well as the smallest part, the abdominal part. Both of these are smooth muscle tissue that are under control of the esophageal plexus. This esophageal plexus is also going to be from branches of the vagal trunks, which come from the vagus nerves, and this region is supplied by the esophageal arteries, as well as advantageous branches from other surrounding thoracic branches. So let's start at the cervical part. Here you're looking at a cadaveric photograph of the posterior aspect of the pharynx here. So we can see some of those pharyngeal constrictors moving along. And then that is going to, that actually goes down to about there, transition at about C6 into that cervical part of the esophagus. This is running posterior to the trachea, which is your windpipe colloquially. So foodstuffs in the rear, air in the front, and that's going to be very helpful to us if we're trying to establish an airway. These are muscles that are under the control of the recurrent laryngeal nerves that would be ascending up to the posterior aspect of the esophagus as well as the larynx, and supplied by blood from the inferior thyroid arteries, as we can see there, which is a branch of the thyrocervical trunk, which comes from the first part of the subclavian artery. Next up, we have the thoracic part. This is the largest part of the esophagus. It runs through the superior and posterior mediastina. Here we actually have the trachea and the primary bronchi that are reflected upwards. So normally these would be sitting anterior to the thoracic part of the esophagus. It is sandwiched between the aorta, so we can see that's the arch of the aorta, and then the descending aorta there, which is to the left of the esophagus and typically a little anterior, as well as the vertebral column, which is just posterior there. Upon the esophagus is an esophageal plexus, which is a nervous plexus derived from two vagal trunks. There's an anterior vagal trunk, which runs anteriorly along the esophagus, and a posterior vagal trunk, which would be out of sight here, running along the posterior aspect of that esophagus. There will also be branches from the sympathetic trunks, which are just lateral here, providing preganglionic sympathetic fibers to those esophageal plexus. The esophagus has esophageal branches from the thoracic aorta, supplying it with blood. And it is going to dive down deep through the diaphragm, which we can see here. And it goes through the esophageal hiatus of the diaphragm, which you can't see here, but is located at about the level of the 10th thoracic vertebrae. And then this is going to lead into the abdominal part of the esophagus, which is just a teeny tiny little bit of the esophagus that's going to deviate left into the stomach, specifically the cardiac region of the stomach. We can see the stomach outlined there. So there is the abdominal esophagus into the cardiac region of the stomach. And so boluses of food move from that esophagus into the stomach for really heavy chemical and physical digestion. There's a lot of heavy lifting that's occurring within the lumen of the stomach. The abdominal part is supplied by branches of the left inferior phrenic artery, which supplies the left hemidiaphragm, as well as branches of the left gastric artery, which we can see here, which arises from the celiac trunk off of the abdominal aorta. So we've discussed the esophagus, its parts, their pathways, their contiguous regions, innervations and blood supply. Thank you so much for your time, and I'll talk to you later.